Hello, and welcome to Solutions for Joint Degeneration and Tears, the Regenerative Medicine Revolution. This presentation is designed to answer some questions you may have about regenerative medicine and the use of PRP, Wharton's jelly, and cord blood. In this clinic, we use a team approach that is results-driven. The team is focusing on results, and it's an integrated medical team approach. Integrated means different medical licenses working together to get the best outcome for the patient. In our clinics, we work with medical doctors, nurse practitioners, chiropractors, and sometimes physical therapists, focusing on exercise, rehab, and regenerative medicine. Sometimes we also offer weight loss and nutrition programs as well. Our focus is on results, and our purpose is to help as many people as possible who suffer from shoulder pain, such as rotator cuff injury, bicep tendon tears and joint degeneration, elbow pain, such as tennis elbow, or chronic sprain or strain, hip and back pain, including bursitis, arthritis, and even failed back surgery, knee pain, mild to moderate osteoarthritis, ligament tears, meniscal tears, and many times patients who are trying to avoid knee replacement surgery, even foot pain, such as plantar fasciitis, Achilles tears, and arthritis. You may ask yourself, is America healthy? We make up 5% of the world population and spend more than the other 95% of the world on healthcare every year combined. We consume 75% of the world's medication. One of the things that we do in this country that doesn't make a lot of sense to many people involved in regenerative medicine is that we treat symptoms. In fact, we've even made it so that symptoms are the target of our care plans in many clinics in this country. The standard of care says, if someone has pain, give them a pain reliever. But the problem with this approach is symptoms are very unreliable when it comes to trying to figure out if you have a condition that's worth treating or not. For example, if we were to look at a disease timeline and try to assess what would happen to a person as they went through a disease process, the start of the disease is on the left side of the screen. Then the events that occurred during the disease are throughout that dotted line. The end of the disease is on the right side of the screen. If you're going to treat that patient, or if the patient were to seek care, a lot of times, they wait until they have symptoms to go and get help. The problem is, in most diseases, the symptoms do not show up, if we're lucky, until the last 10% of the disease. An example of this would be cardiovascular disease. Cardiovascular disease is the leading cause of death in the United States. 50% of the people who have cardiovascular disease, or people who die from cardiovascular problems, the very first symptom they had was the heart attack that killed them. So 50% of the leading cause of death in the United States, the symptom shows up at the very end of the disease. Cancer, very similarly as far as presentation of symptoms. You can have cancer for years before you get your first symptom. In fact, the symptom shows up many times at the end of the disease. With regenerative medicine, we're not focusing just solely on getting rid of the symptom. We are more focused on correcting function so the symptom goes away and stays away. Let's look at regenerative medicine and stem cells in use with chronic degenerative arthritic conditions, which is the leading complaint that Americans have. What you're looking at is a picture or a schematic of a typical joint. The top of that picture is one bone, and you can see it capped by the cartilage, which is in the yellow. And then it's separated by a synovial fluid, which is held in by a synovial capsule, and then the bottom bone, which also has cartilages further down. This could be a typical knee or hip joint. What happens is the joint does not have a direct blood flow into the synovial capsule. What happens is you have to have movement of one bone on the other to pump nutrition across the synovial membrane. If the joint doesn't move, it will degenerate. If you look at a patient who, say their arm is immobilized in a sling and they left it that way for a couple of years, most people would realize, yep, if you took that sling off, they would not be able to move their shoulder. It would have dehydrated that shoulder joint and they would have a lot of arthritis in the joint. When you have arthritis, it comes from a lack of movement, would usually come from scar tissue. What happens is the scar tissue limits the movement of the joint, which decreases the amount of nutrition into the joint, and then the joint starts to degenerate. The inflammation is actually the blood trying to force itself into that joint and the surrounding tissue. The inflammation from arthritis is usually not where it's supposed to be in trying to heal the tissue, but on the outer part of those tissues. What happens is when you get arthritis, the joint doesn't move properly, and then this space in between the bones decreases because it's dehydrating, which causes remodeling of the bone over time, which would be the spurs and the little lipping and spurs you see on the joints. Inflammation of a joint, particularly the soft tissue around it that holds it together, is how people get arthritis. It's important to remember that movement of a joint prevents arthritis. How do people get scar tissue that prevents movement? Well, let's take a look at this. The average American is in a car accident within the first 2 years of driving. The average American has a car accident every 7 years. In fact, it is less than 2% of drivers that can say they've never been in a car accident at all. If you look at the physics of a motor vehicle accident, the force involved in the injury is equal to the mass times the acceleration. That would mean the weight of the car times the speed of the car. Now, a horse injury. If you fell off a horse that was going 20 miles an hour, the force would be your weight times the speed of the horse. If you fell off that horse and you weighed 200 pounds, the amount of force that would hit your body when you hit the ground would be 4,000 pounds. But if you're in a motor vehicle that weighs anywhere from 3,000 to 6,000 pounds, and we took 4 as an average, 4,000 pounds going 20 miles an hour is an 80,000 pounds of force. When you see how that translates to your tissues, your head goes whipping back and forth because your body is trapped in, and this can cause microtrauma to the tissues around the joints of the spine. When that happens, the microtrauma is healed up by the scar tissue. And now all those joints have a little bit less movement or limited movement, which causes degeneration. If you look at the case of the spine, we look at a normal healthy joint with healthy discs because the joint has to move independently. The 2 vertebrae have to move to continue to pump the nutrition into that disc. When you have an injury, phase 1 could go on for a couple of years where it's just decreasing the amount of nutrition in that disc. Now, this could be a totally asymptomatic phase. During that time, the body could move into phase 2 where the bones are actually starting to remodel and develop spurs. The whole time the disc is dehydrating, so the space between the 2 bones is getting less and less. And somewhere between phase 2 and phase 3, people usually show up with symptoms and come into a medical office to try and get treatment. Sometimes, waiting until phase 3 is beyond repair and more dramatic and drastic measures such as surgery have to occur. The typical treatment cycle in this country is when people start to get the symptoms, they go to their doctor. And the standard of care is, well, if you have joint pain, let's give you something to relieve the pain, like a non-steroidal anti-inflammatory or NSAID. Then if you get the same or increased pain, because eventually that will artificially stop it, but your body will keep trying to heal so the pain will come back. Then the doctor prescribes stronger non-steroidal anti-inflammatories or even pain relievers. As time progresses, he may order x-rays and that's when he discovers, oops, well, we've got arthritis. So let's do some cortisone injections, and then it gets worse. So the doctor will order an MRI and eventually you will become a candidate for arthroscopic surgery or full replacement surgery. Let's look at this. What about the non-steroidal anti-inflammatories or even the pain medication? What are they trying to accomplish? Well, the purpose is to alleviate pain at the nerve level or the brain and spinal cord level, or lower pain causing inflammation at the site. The problem is these drugs do not address the cause of the tissue damage, and thus the tissues continue to degenerate over time. It's like having air leak in your tire, and all you're worried about is the sound it makes and not actually fixing the tire. These drugs do not heal or regenerate anything. Non-steroidals are linked to ulcers and heart attacks, and have been thought to be responsible for more than 15,000 deaths per year from bleeding in the stomach from taking non-steroidal anti-inflammatories. So there is a danger. Not only do you cover up the symptoms your body is trying to make you aware of and is what it uses to heal, but the drugs themselves have side effects. What happens is then your doctor says, Well, let's use cortisone injections because now that we've looked on the x-rays, we know you have arthritis. The cortisone injection's purpose is to try and break down the scar tissue. That's why people use cortisone. It actually does that. The problem is, it doesn't just zero in on the scar tissue. It breaks down all tissue, which is why it has to be limited. It degrades bone density and the cartilage over time. Putting this in to stop arthritis actually weakens the joint in the long run. It eventually worsens and speeds up the joint degeneration. It's only temporary. It's for pain relief mostly, and eventually it wears off. The doctor has to limit it no more than 4 times because of the amount of damage the cortisone does to the joint. It can also increase and worsen systemic diseases such as diabetes and cause weight gain. And again, has to be limited. The typical treatment cycle now brings you to the point of surgery. And with surgery, these pictures are pretty graphic. This is a picture of an arthroscopic surgery, and you can see the 3 probes that are in the person's knee. Everywhere these probes touch create scar tissue, and scar tissue will accelerate the degenerative process. The purpose is to try and go in there and clean up some of the debris, and maybe break down some of the adhesions that are in there. But the process of going in there creates more adhesions in the long run, and there's plenty of opportunity for infection. If you look at, say, a knee replacement, now they're opening up a leg straight down to the bone, and they're cutting off the ends of the bone and replacing it with man-made devices so that you can get some temporary articulation, which usually lasts 10, maybe 15 years, then it has to be done again. The potential for side effects and the potential for infection in this type of treatment is dramatic. You can look and see here. This is a picture of a hip surgery, and the tools look more like carpenter's tools than what you'd expect a surgeon to be using. There are problems with surgery, and it should be avoided if at all possible. After surgery, you'd have to go through painful rehab to break down the adhesions that may have been formed during the surgery. This can sometimes take months. Also with surgery, the potential for infection is dramatic. When an infection gets into a joint, that joint can start to degenerate at extremely alarming rates and may result in a knee or hip replacement because of the surgery. With regenerative medicine and the regenerative medicine revolution, we take a different approach, regenerative therapy, and the goal is to try to get tissues that have stem cells to stimulate your body's healing. What are stem cells? Stem cells are the primary basic cell template that changes to become cells of all tissues, from bone to tendon, to glands to organs. If you look at it in the schematic, you can see a stem cell can actually change into other tissues. For example, a stem cell is a cell that is waiting for an identity. Based on what your body needs, you normally take stem cells and you grow it into, say, a muscle cell. Or you could grow it into a skin cell or a bone cell. Or into a tendon cell, an organ cell, a nerve cell, and it can even turn into more stem cells. This is how your body normally heals. When you're younger, because you have a lot more growing to do, you have a lot more stem cells, and they can reproduce into a stem cell at an infinite rate because there's so much growing that's going on in your body. But the older you get, the less stem cells there are, and the less viable the stem cells are. They have a limitation to how many times they can reproduce the older you get. This is why younger people heal faster than older people. Mesenchymal stem cells are primarily the form of stem cell that is the basic connective tissue stem cell that forms the framework of organs, nerves, skin, muscles, ligaments, tendons, cartilage, etc. Mesenchymal stem cells are the type that are most desirable when used in regenerative medicine. The way it works is you're trying to accomplish tissue repair. In this picture, you see the blue heptagons are cells that are healthy body tissue. What happens is, as we get older, we have things happen to us and we regenerate less, so we try to develop dysfunctional tissue, and that tissue becomes more prone to injury and more prone to disease. The use of stem cells is designed to transfer clean human stem cells into your body to help them regenerate tissue. That's the theory. One of the tissue sources we use primarily is predictive biotech, and they use various types of products. But on this chart, you can see their peripheral blood, which comes from your body, and that would be PRP. Or then there's placental tissue, which has amniotic fluid, amniotic matrix, and amniotic membrane. And inside that amniotic membrane, there's umbilical cord tissue and blood. You can get these from other sources, and we'll explain that in a minute. You can also get stem cells from your own body by extracting it from bone marrow or adipose tissue. The older you are, the less healthy you are. The less likely these sources from your body are designed to work. Peripheral blood tissue, or PRP, would be extracting your blood and concentrating the platelet-rich plasma so that you can inject that back and to stimulate your body into a healing process. But it's not likely to help you increase the amount of stem cells in your body. Let's look at how this program works. Wharton's jelly is the jelly that's in the umbilical cord that surrounds the blood flow to and from the baby from the mom's placenta. If you notice, the Wharton's jelly is loaded with cells, and those cells are among many things. Stem cells, particularly mesenchymal stem cells. The Wharton's jelly is the richest source of mesenchymal stem cells anywhere in the human body, and they're so rich in it because the baby is using stem cells constantly to grow its body. Now, the amniotic membrane is the barrier that protects the baby from the mom's immune system. So, Wharton's jelly is the protective layer in the cord. It is the richest source of mesenchymal stem cells. If you look here, here's an extract of a baby, or a picture of a baby in utero before birth. And you can see there's a placenta, and there's two sections in the placenta. The chorionic side, which is the darker red, and the amniotic side, which is the lighter red, which is also called the amniotic membrane. Then there's the umbilical cord. Everything from the amniotic membrane in is considered immune privileged, and that's because the baby has a different immune system than the mom. And the tissues inside the amniotic portion of the placenta protect the baby from the mother's immune system. And you can see that's the layer right there. They found that getting stem cells from these tissues can be used pretty much in anybody because they have the immune privileged characteristic. This research goes way back. This is an article from the Journal of the American Medical Association from 1913, where they were taking the grafting of preserved amniotic membrane and using it on burn victims and healing the skin of these burn victims. It's the grafting of preserved amniotic membrane. This technology has been known for a long time. This is the picture of PRP, where your blood is extracted, put in a centrifuge, and spun down to concentrate the plasma that gets injected back here. The idea here is this plasma is loaded with hyaluronic acid, growth hormone, and healing cytokines, and it will attract your own stem cells to the area. But the human cellular tissue products, HCTPs, that we use come from healthy-born babies. Cord blood, Wharton's jelly, and amniotic tissue are some of these tissues, and basically the FDA has cleared these to be safe. They're donated by healthy moms after a healthy live birth. And the placental tissues and fluids are processed in clean room environments that exceed the American Association of Tissue Bank standards, or the AATB. These moms and babies are screened for 9 months prior to the donation to make sure that they have no diseases and that they have very safe tissues. What happens is the regenerative tissues, HCTPs, growth factor, protein, collagen, hyaluronic acid, and stem cells, when injected into an injured area, the theory is that these stem cells in the regenerative tissue stimulate the repair, and your body regenerates only what is needed to be repaired. It basically gives you the healing power of a young, healthy baby. That's the theory. Recent research and clinical literature suggests that cartilage, ligament, tendon, muscles, discs, bone, nerve, etc. can help you regenerate with this type of therapy. It's a very safe procedure. It's an in-office procedure. It takes about an hour or less. There's no anesthesia, no hospital stays, no antibiotics, 0 recovery time, maybe just a little bit of inflammatory response around the injection site. We expect to see significant improved function within 1 to 3 months. Sometimes it can actually be a bit longer, but this is not a quick fix. This is a long-term attempt to get your body to fix a joint to its maximum medical improvement. Minimal adverse effects. The typical adverse effects could be mild fever or flu-like symptoms which could occur, if they occur at all, in the first 24 hours. And they're gone within 24 hours. You can have an injection site ache or swelling, and some people report a mild inflammatory response for sometimes even a week or so after the injection. That is to be assumed to be the healing process taking place in that joint. Now, here's a couple of clinical stories we've seen. This is a patient who's a female, 43-year-old physician with debilitating right knee pain. She had no history of specific trauma. Over the course of 2 years, her knee pain worsened to the point of not being able to climb stairs, which she had to do sideways, or get out of a car without almost collapsing in pain. This doctor was an avid runner and couldn't even walk upstairs. She stopped all exercises for 6 months due to pain before getting regenerative therapy. She had ligament tears noted in her knee joint on different diagnostic studies and had a history of arthritis. What happened was the patient got injected, and on the day of the injection, she noticed a week later that she was able to run up and down the stairs with minimal pain. She noticed that after about 4 weeks, she had described herself as 80% better and could do squats with almost no pain at all. Then finally, after about 2 months, the patient described herself as 95% better, able to return to exercise, pain-free running, squatting, and lifting. Our second patient story is a physical therapist. Female, 54 years old physical therapist with debilitating bilateral knee pain. She had numerous knee dislocations to both knees over 20 times each as a child. She was recommended for arthroscopic surgery at age 22 and was told she would need knee replacement in her 40s or 50s. She did rehab, nutrition, which included glucosamine and chondroitin sulfate, chiropractic care, and hyaluronic acid injections. It all seemed to help, but she still had problems sitting crisscross with her children, wearing high heels for more than a couple of hours. And she could not run at all for over 30 years due to pain in her knees and had difficulty going up and down stairs and could not do a full squat. After she got injected, the day of injection she noticed a week that she had mild inflammation in both knees. She noticed in about 4 weeks that she was able to wear high heels for a 2-day conference with no consequences. She also noticed she could do a full squat to get a case of water on the bottom of her shopping cart when she was shopping. She also reported to us that she decided to take up running after 12 weeks because she wanted to get into shape, to her pre-baby shape after her first child was born 20 years earlier. She describes herself as 95% better, and her quote to us in her testimonial was, "It's strange not having anything bother my knees after having problems with your knees for so long." Here's some pre- and post-x-rays of patients in one of our partner clinics. This is a patient in July of 2016. And as you see, the space between the bones are missing a little on the left side and a lot on the right side if you notice the left marker on the x-ray. After almost a year, you notice there's more space in those x-rays. This was the x-ray of the physical therapist with the knee dislocations. And at this point, April 2017, she was completely pain-free. This is another patient in a clinic in Chattanooga, Tennessee. Notice how the knees were more narrowed on the inside, or what we call a medial side, which is a typical presentation for knee degeneration. This patient was recommended knee replacement surgery. She was injected in February of 2017, and by September 2017, not only was she feeling much better, but we noticed clear space all the way through both joints on both sides. This is another patient from the Collierville, Tennessee clinic, which is a Memphis suburb. You notice the very pronounced degenerative effect on that right knee with the very pronounced spur developed on it, and absolutely no space. This patient could not walk up and down stairs. She got injected in February, and by May, she'd been going up and down stairs with little or no pain. And this x-ray demonstrated that she had complete space throughout her entire joint. This is another knee patient from Chattanooga, Tennessee, 2016. Notice the degenerative spots on her knees and then increased joint space all the way through. It's not perfect, but these patients are much better off. And this patient is at this point, much better and doing things she hadn't been able to for years. It's not just knees we work on. We work on a lot of joints, but those were just some examples. The typical national average knee replacement is $25,000 to $50,000. The out-of-pocket deductible on co-insurance usually runs $3,000 to $15,000, and there's complications. Knee replacement surgeries and hip replacement surgeries have a very high complication rate. Spinal surgeries have a 70% failure rate according to the surgeons themselves. There's a lot of potential for infection and complication. Now, The cost of regenerative medicine injections usually runs from $5,000 to $11,000 per injection depending on how much is being injected, and it's usually a one-time treatment, and that's the end of it. What you just watched was an explanation of how we use regenerative medicine in this office. And someone will be with you in a minute to discuss your options to see if you're qualified for this type of treatment. Thank you for listening.